Hello there and welcome to the COVID-19 update for today, May 20th, 2021. I'm your host, Gomiti Gangadan, saying thank you for joining us. As usual, we have with us this morning the Minister of Health, the Honorable Dr. Frank Anthony. Dr. Anthony, thank you for joining us. We're also joined by Kurt Campbell from the newsroom. Dr. Anthony, the ministry is slated to host a drive-through vaccination event this weekend. Can you tell us what that is all about?
Well, one of the things that we're trying to do is to make vaccination more accessible to people. And we had a discussion in the ministry, and we thought that this is one way that we can make it more accessible, more convenient for people to come and get their vaccines. So what we have in mind is that you can drive into the stadium with your car. Once you get into the stadium, those arrangements are in place where someone would approach the car, see how many of the occupants in there would need vaccination. Then they would do the paperwork for the vaccination, and then you proceed to the next station. That station, that paperwork is verified, and then they will do the actual jab, and then you move on to the third station, where you wait for a 50 minutes period to observe whether or not you have any side effects. And once everything is clear, you can then drive off and you've received your first dose. Because of how it's arranged, we think that we'll get a lot more people coming out, and it's quite convenient. So if 4 persons are in a vehicle, we can easily do 4 persons in that vehicle very quickly. We'll have a number of volunteers. We are expecting to get probably about 40 people volunteering to assist us with the write-up and so forth. And these are persons who have worked with us before, have done quite a good job. And we'll have enough vaccinators so that if you have 4 or 5 persons in a car, we can easily do that. So I think it's, while it's innovative and novel, I think we should be able to get a lot of people vaccinated once we have persons coming to do that. We have been collaborating with a number of agencies, so the Ministry of Culture, Youth and Sports has kindly granted us the use of the stadium. Ministry of Public Works is helping us with lighting. Ministry of Home Affairs and the police, they're helping us with traffic control. And we have a number of community organizations, a number of faith-based organizations, and we're hoping that we can also get the Rotary and the Lions involved in assisting us with moving people around. So those discussions are continuing, but I think we'll have everything in place, ready to go early Saturday morning so that we can start rolling this out. You would also notice that we are starting from 9, and we are going until 9 in the night. So we would be able to accommodate quite a lot of people, once we get a steady flow of traffic coming through. So we hope that people take advantage of this opportunity, and that we'll be able to immunize quite a number of persons with their first dose. If there are persons coming for their second dose, we'll be able to do that as well.
Okay, is this a pilot, or are there plans there to put it across all the regions?
Let's first test this one out, and if it works well, then we can replicate it. If there are hiccups that we identify, we are certainly going to learn from the experience. We're going to fix it, and maybe replicate it in other areas. But let's see how this one works.
Okay. On the same topic of vaccines, some persons on social media have expressed their concerns that while they're hearing about the Sputnik and the AstraZeneca vaccines, they're not hearing about the Sinopharm. And so persons are concerned whether they're going to get their second doses of that vaccine. Can you speak on this issue?
Well, I don't know how many people should be concerned about that, because we have administered the Sinopharm vaccine. We had 20,000 doses. We have administered most of that, about half of that as the first dose. And right now we are probably about 89% or so of persons who have received first dose Sinopharm getting their second dose Sinopharm. So those persons who have received first dose and haven't come forward as yet, we have your second dose vaccine for you. You would have noticed, because we had a limited supply of Sinopharm, 20,000 doses, that we are no longer offering Sinopharm as the first dose vaccine, but only offering it as the second dose for persons who have received Sinopharm first dose. So there shouldn't be any worry, because we do have your second dose, and by now most people who would have received the Sinopharm first dose would have been due. So those who are still lagging should come and get their second dose, so that we can, you know, move that aside in a sense, you know, because we are almost complete with Sinopharm vaccines.
Okay. We have seen a number of increases in the cases in the hinterland regions. Does the government and the Ministry of Health have any plan at this point to increase, whether it's resources or infrastructure, anything in the hinterland regions to combat these increases?
Well, we have about 1,900 and something active cases across the country. Most of those cases are really in regions 2, 3, 4, 5, and 6, and 10. In the hinterland, while we have cases, the regional task force that we have there have been closely monitoring those cases, along with the committee from Georgetown. We have been closely monitoring those cases. And where we see surges, we have sent in our medical teams from the region to extend testing, so that we get a better picture of what is happening in that particular village. And if it's necessary, to bring some of those persons and put them into institutional isolation. So far, in regions 1, 7, 8, and 9, we have been monitoring the situation and working with the various communities to do that. Our problems in Region 9 have been compounded a bit because of the flooding in a number of communities. But we continue to send out our teams to those communities. So the teams now are doing basically work in several areas. One, to look for COVID, do the testing, and also vaccination, because we haven't stopped vaccination. So we're doing vaccination for persons in Region 9. Plus, we currently have a campaign that is ongoing to distribute Malaria Net, which was launched early in the week. So that is also being rolled out. And at the same time, we have started monitoring for diarrheal diseases and other waterborne infections. So we are working. We have a strong team. If it's necessary, we'll add persons from Georgetown to go into Region 9 if that is necessary. In the other regions, so far, they have been coping well. In Bartica, we have seen a number of cases, and we've had a few hospitalizations at Bartica Hospital, but those patients are quite stable. Region 8, similarly, we had a few cases at the Madhya Hospital, but those are stable as well. Other than that, the active cases are really in home isolation, so they're not in a severe condition. Those that have moderate to severe conditions are in the hospital. And in Region 1, we're doing similar things. But in all these regions, while we're testing and treating for COVID, we are also doing immunizations.
Okay, I'm going to hand it over to my colleague, Kurt Camp. Please go ahead.
Thank you, Ms. Gambardon. Minister, thank you for agreeing to speak with us. The first question I wanted to ask is on the Brazil variant in Ghana. PAHO said 4 days ago that it's here, but they're yet to confirm the information with the government. Can you first of all say who within PAHO the government has sought the clarification from? Is it unusual for them to take this long to clarify such a serious claim? And I also wanted to ask what the government has done independently to verify whether the variant is here or not.
Well, the only way you can determine whether there's a variant in any country is that you have to do genetic sequencing. As you know, we would have sent samples to CARFA sometime early in the year. We had sent 10 samples, and none of those 10 samples we have seen anything that resembles a variant. So the results from CARFA, they have told us we have what was the variant that was circulating before, nothing of the variants of concern. Those are the only 10 samples that we are aware of that went to a lab for sequencing. Where PAHO probably got its information, I don't know. And that's what we are seeking to clarify, how they arrived at this conclusion that Guyana has variants circulating. We haven't received that clarification as yet. We have sought that clarification from the local office here, and we still await those clarifications, discussion.
Can you say when the 10 samples were sent to CARFA, and are there plans to send more for genetic sequencing?
At this point, I don't have the exact date, but if you go back, I'm sure we would have made an announcement on that. Certainly, we are trying to work out arrangements to have more sequencing done. But again, these things take time, and you know, we'll continue to pursue.
No problem. On the Sputnik V vaccines in Ghana, can you clarify how many doses would have arrived already and a breakdown of between component 1 and component 2?
We have purchased 800,000 doses of Sputnik V, 400 of each of the components, right? We have received, I would say now, maybe about 100,000 or more of the component 1, and we have similar amounts of the component 2. So the numbers might vary just slightly, but generally we are in that ballpark of 200,000. So the rest of the vaccines, which is 600,000, those would be coming in different tranches.
Initially, we had heard about the 400,000 and the additional 400,000. I just wanted to know if the agreement for the second 400,000 was brokered through an agreement with a company in the UAE or with the direct office of Sheikh Ahmed.
All of these vaccines we are sourcing via the UAE, and so that's how we've been getting the Sputnik vaccines.
I just want to know if it was an arrangement with the government or if the Guyana government is talking with the company. They actually have a name of a company.
We have been working with a company.
Is that company Arugov?
I don't have the name.
And it's
Those administrative matters are handled by the administrative people in the ministry.
And it's the same cost.
Yes.
Okay. That's okay.
All right, Dr. Anthony, last question before we wrap up. Guyana has reopened its airports and we're seeing daily flights in and out of Guyana. Could you say, or do you have any figures at this point on what our imported cases have been like? And do you think that it is a cause for concern at this point?
Well, we have opened our airport sometime now, and over that period, because of the monitoring that we do at the airport, we have detected 51 cases of COVID-19. Those persons, once we detect them, there's a protocol of isolation and so forth. And so over this period, we have had 51 cases. And we haven't, over the last, I would say, month or so, been able to detect any cases. That doesn't mean that we're not monitoring. We have strong process in place to monitor. No one can travel to Guyana without a PCR test, and we have maintained that. If you have a PCR within a 3-day period, then upon arrival you don't have to quarantine. If you have a PCR that is longer than 3 days, then you will have to do a second test upon arrival in Guyana. So that protocol has been in place, and with that protocol, those people who would have had The second test done, we have been able to identify 51 who would have been positive.
Okay, Kurt, do you have anything else to add?
No, that's it.
All right, thank you, Dr. Anthony. That has been the COVID-19 update for today, May 20th, 2021. Thank you for joining us. Do have a blessed remainder of the day. Goodbye.